Doctor, we need a doctor.
What seems to be the problem here?
This man was trying to kill himself.
Why would he do something like that?
I don't know. He doesn't even remember his name. Doctor, what should we do?
First, call Sharon from the front and tell her I can't clean up the blood from earlier's incident. And second, we got a mystery on our hands.
Alright, right away, Doctor. But what's the mystery?
The mystery is why would this man kill himself and what's wrong with him? You look very similar to your son.
Well, he does have half of my chromosomes.
Do you mind if we ask you some questions?
Please, ask away.
Let's sit down.
Sure.
Has your son's behavior or personality changed at all in the last few months or years?
Yes, actually. A couple of years ago, around 32, he started becoming very irritable, and he was not behaving the way he usually is.
What do you mean? Does he have a mental illness?
He does, but I can't remember exactly which one. And he's been acting very weird, as in, he'll be happy one minute, and then the next minute he'll be completely full of rage.
Any other differences you've noticed?
Yes, he's been going to the library, and every time I would go and see him in there, he would be reading the same exact book, and for some reason he would be crying.
Nurse, why don't you go to the library and see if you can find any clues?
What am I supposed to do in some library some suicidal person cried in?
Did you say crying?
Yeah. What's it to you?
This might sound crazy, but somebody with a mental disorder would come to this library and just cry.
Mental disorder? Like a genetic one?
Yeah.
Remember which one?
No, but he said it was on chromosome 4 or something like that.
And
the mutation was called a CAG. Repeats, it's an insertion, and the mutation was more common with people with European backgrounds. And also about 30,000 people will have this disease in the US.
anything else?
Yeah, usually in this section, the DNA is repeated 10 to 28 times, but with the disease, it's actually repeated 36 to 100. The last gene was called HTT, and it was on the short arm of chromosome 4. Oh, and the amino acid didn't change.
Any other changes?
It has little effect on the translation and transcription because none of the amino acid codes are changed. It just repeated too much.
Thanks, well, I gotta go.
I need more information. All I know is what the dad said.
Hey, wanna buy some cookies?
No,
Problem.
a suicide genetics case.
Does that have to do with Mr. Huntington?
Tried to kill himself. Do you know him?
Kinda.
What do you know about him?
Well, I know his youngest daughter. She's a huge brat, though.
What do you know about her?
Dad has this genetic disease, and ex-wife, was a carrier, so his daughter had like a 50% chance of getting this disease, and like a 100% chance of being cured.
Wow, that's terrible.
Yeah, I know. She took this genetic test yesterday.
Do you know anything about her possible mutation?
Yeah, it happens on the DNA sequence CAG. It's three base pairs, cytosine, adenine, and guanine.
Alright, thank you. I gotta go find the nurse. Hold it.
What's the problem?
Who are you? This lab is restricted.
I'm a member of the Huntington Hospital, and I need access to a patient's files.
Who are you?
He's with me.
Beat it, kid.
We're in.
I forgot my code.
Forgot.
What?
The problem was his memory.
What?
His disease. It slowly causes his brain to deteriorate.
Really?
He said he only had 20 to 30 years after his diagnosis, and the number of CAGs produced could change his life expectancy.
Really? Does the disease get worse as it goes on?
Yes, it gets worse as time goes on.
Really? Because now I know the disease. We have to go find the doctor.
Nurse and doctor compared the information and are walking back to the hospital.
We know all we need to know.
Chromosome 4, the overproduction of CAG, brain deterioration, and the 20 to 30 year life expectancy.
It leads to one thing.
Huntington's disease.
Sir, we have a diagnosis.
It's Huntington's disease.
What's Huntington's disease?
Huntington's disease is this mental disorder happening on chromosome 4.
Does it?
It's on a DNA sequence called CAG.
But doesn't everybody have CAG?
Yes, but in Huntington's disease, the DNA sequence CHE is repeated 36 to 120 times, not 10 to 28 like normal.
Oh, alright.
Well, and the disease also causes mental problems at first.
It also causes irritability, restlessness, paranoia, and hallucinations.
Why would he try to commit suicide?
Well, sadly, a lot of Huntington's disease patients commit suicide.
Will he be okay though?
Well, in Huntington's disease, as the disease progresses, the brain begins to deteriorate faster and faster. So they don't only lose memory, but they also lose their common sense. So they might not think as clearly. Many people with Huntington's disease don't want to be a burden on their families.
Will he be okay?
Well, sadly, after symptoms start showing, the patient normally only has about 20 to 30 years, depending on the number of repeats in the cAG-DNA.
Well, now that you know the disease, can you cure him?
Well,
Okay, so we can't really cure the disease, but we can treat certain symptoms to make it less harsh on him.
Alright.